Hello future doctors, welcome to my YouTube channel. Myself Utkarsh Gupta, studying in MBBS second year. So today we are going to do a pharmacology topic, that is anti-Parkinsonian drugs. So first let's talk about what is this disease. It is an extrapyramidal motor disorder. The patient shows symptoms like rigidity, tremor, hypokinesia, defective posture, gait, and the main symptom is the mask-like face, and it mostly affects the older people. So now what is the mechanism behind this disease? How this disease is caused? So in this there is a degeneration of neurons in the substantia nigra and the nigrostriatal tract. Because of this there is a deficiency of dopamine. There is an imbalance between the dopaminergic, that is inhibitory system, and cholinergic, that is excitatory system. Because of this imbalance, there are motor defects which causes our disease Parkinsonism. Parkinsonism is characterized by as a dopamine deficiency, which now we have seen in the mechanism, dopamine deficiency state, and there is a medicine named levodopa which is used to make good in this deficiency. So now let's talk about levodopa. Levodopa has a specific salutary effect in this disease. It is an inactive by itself, but the immediate precursor of dopamine. So what are the actions of this levodopa on other systems? Number one, central nervous system. Since we have seen that there are symptoms like hypokinesia and rigidity, so when a patient is on levodopa, hypokinesia and rigidity resolves first, and after that tremors are resolved. On behavior, it shows general alerting response, which on progress there is an excitement in the patient which may cause frank psychosis. Frank psychosis is a condition in which the patient is too much excited. There are five subtypes of dopamine receptors, D1 to D5. So they are grouped into two, like D1 like. In this D1 and D5 receptors come, and these are excitatory receptors. And number 2 is D2 like. In this D2, D3 and D4 receptors come, which are inhibitory type receptors. Now let's see what is the effect of levodopa on cardiovascular system. In cardiovascular system, it causes tachycardia and arrhythmias as it acts on beta adrenergic receptors. On endocrine, it acts on pituitary gland, which pituitary glands inhibiting the prolactin release and increase the growth hormone release. Now let's see some of the adverse effects of using this medicine. So these adverse effects are grouped into two therapies, like at the initiation of therapy or at the beginning of the therapy and after a prolonged therapy. So in the initiation of therapy, the patient may show adverse effects like nausea, vomiting, postural hypotension, which is more frequent in patients which are on antihypertensive drugs. And the patient may also have cardiac arrhythmias or alteration in taste sensation. In prolonged therapy, there is dyskinesia and it worsens with time. There are behavioral effects like anxiety, nightmares, hallucinations, and frank psychosis, as we have read in the actions of levodopa. There are fluctuations in motor performance also. Let's talk about its cautious use. It is cautiously used in elderly peoples, in patients having ischemic heart disease, hepatic disease, renal disease, or psychiatric disease. It is also contraindicated in peptic ulcer as it increases bleeding, and it should be cautiously given in glaucoma and gout. Now let's learn about few of its interactions. Pyridoxine abolishes therapeutic effect of levodopa. And if levodopa is combined with carbidopa, this effect is inhibited. Metoclopramide blocks dopamine receptors and antihypertensive drugs. There are other group of drugs like peripheral decarboxylase inhibitors. In this, carbidopa and benzodiazide are extracerebral dopa decarboxylase inhibitors. They don't inhibit conversion of levodopa to dopamine in brain. What is the use of peripheral decarboxylase inhibitors? Levodopa, when combined with these inhibitors, they increase the half-life of levodopa. Now let's see what are the benefits of combination with levodopa. Half-life is increase of levodopa and dose reduced to 1/4. Systemic concentration of dopamine is also greatly reduced. Cardiac complications are reduced and pyridoxine reversal does not occur. Now there are other group of drugs like in the MAO-B inhibitors. There are two isoenzymes of MAO. There are two isoforms of MAO. MAO is monoamine oxidase, MAO A and MAO B. MAO A is present in the peripheral adrenergic structures and MAO B predominates in blood and brain. Inhibitors. MAO B oxidizes dopamine. So MAO B inhibitor is one of the most common MAO B inhibitor is selegiline, selective MAO B inhibitor, and it is administered with levodopa. It decreases wearing of effect, and it is contraindicated in the patients with convulsive disorders. So this was all about Parkinson disease. If you have any doubt, you can let me know in the comment section. If you are new to the channel, please subscribe. Thank you for watching.